I'm Sarah, and this year I participated in Dry July. I decided to do Dry July because it was personal to me, because earlier this year I had a cancer diagnosis. Being in the hospital myself, having treatment, just seeing how patients are in the hospital and being on that side of things, knowing that the money is going to go towards patient comfort, patient care is really important because it's not a nice experience, and just to make sure that patients are being cared for properly and looked after and comfortable just makes their experience that little bit more easier.
It was a challenge. It certainly made you stop and think about having a clear head and making a difference as part of the slogan. I love the opportunity to be able to participate as part of the HRF and as part of the GM's team.
Dry July is behind me, and to be frank, I'm feeling good for it. I've gotten over the fact that I'm not sleeping. I have read at least half a dozen books, and my evenings have been extraordinarily productive.
That was difficult for me, but having done it, I'm really glad that I did. I've slept very well. I've thought a lot about my drinking and whether I should perhaps do it on a more regular basis. I'm thinking of giving up beer. I said thinking of giving up beer. And then when I came here today and saw the work of Dry July, I realised that I'll be doing it again next year. One of the things that was most moving was talking to Michelle. Michelle's got non-Hodgkin's lymphoma.
I've been down here on and off since the beginning of March when I was first diagnosed, and I've spent a lot of time in this unit with this hospital and all the nurses here, so a lot of the things that the guys have done in previous years with Dry July I've seen around the ward, and in terms of games and renovations and things like that have made a difference I can see to other people and their families and things like that. Early March this year I was told, and I'd had a various number of symptoms which I had no idea why I was feeling. I had pain in my face, I had other symptoms which didn't really link in together, and the last thing I thought was for a doctor to tell me that I had cancer all throughout my body. Yeah, essentially I came straight here, and I think it was within the week I had all of the tests and started chemotherapy straight away. I had very intensive chemotherapy, so all of my chemotherapy has pretty much been inpatient, and that's just because of the risk of once you've had chemotherapy and your blood counts go down, you have risk of infection and immune problems and things like that. So I've spent a lot of time here since then. It's been a long journey. I can see that everything that Dry July is doing, particularly for rural and remote patients, is going to be really important because they're not quite as lucky as me as having that constant contact with their family and friends and things like that.
Well, we still have a few days to donate, and every little part, every little cent counts, so dig deep and just give what you can.
Hi there, I'm Rosanna Mangiarelli from Channel 7's Today Tonight. I just wanted to say it was fantastic to be part of Dry July 2011, and I'd like to thank all my supporters. Thank you for your kind donations, and also to everyone else who jumped on board. It really is a fantastic cause, and it does great things for cancer patients. Let's just hope you can jump on board again next year.
Thanks for being part of Dry July.